Morning. We are going to do the peds and OB this morning. We have a lot to cover. I want to cover peds, OB, and a little bit mental health, and then geriatric. Just a few questions, how you should look your answers. Now, you remember, everything is included, so you never know what. So whatever I want, you guys need to know we are going to go over. So I will start peds on your booklet is page number 2, and the beginning you have peds, so I'll start with the peds. In peds question, I want everyone, any questions when you have newborn baby and peds, you have rashes. Rashes are okay, but with rashes and fever, you need to make more assessment. Fever is always sign of infection. Caflex word is penicillin. Remember when you guys have done antibiotic, whether it's a peds, OB, or med-surg, Caflex medication, cephalosporin is your penicillin. Always before you give any antibiotic, and if they are allergic to Caflex or penicillin, you cannot give. So remember your drug questions, same as we have done before. I'm going to go over the newborn babies, starting with the peds. This is umbilical cord care. Newborn baby is born. Cord care is important. And page number 2, everyone is okay? You guys, peds, page number 2 you have? Or if you have another package, maybe on different pages. So look on that is peds. Which one? 69, so you have a little different package. But the ones you have a rearranged package, you guys have on page number 2. Umbilical cord care for the newborn babies are to keep it clean and dry. And the first line, you can use alcohol to wipe it and fold the diaper down and keep the diaper off. And sponge bath is good, and always monitor for sign of infection. So umbilical cord care, monitor for infection, keep it dry, bath is good, and you monitor the baby and prevent them from infection. Everyone got your peds notes okay? Not sure. 78, some pages may be like my page 78, the older one, okay. Now, and maybe some may have a little bit differences, few wording we have revised it. So when I say something, add it if you don't have in your packet. So remember the word I said earlier, rash and fever. Fever, sign of infection, assessment. Umbilical cord care, keep it dry, monitor for infection, fold the diaper away, and sponge bath is good. It should take about 7 to 10 days to dry up the cord. Next one is circumcision question. If Gomco or Morgan is used, then apply petroleum jelly covered. So you can use that. Second line is clean it with water and warm water, keep it dry. And petroleum gauze is not necessary if they have used plastic belt. Leave the plastic rim in place. And monitor, again, circumcision for infection. And yellow crust is normal, don't touch that. Number 3 is hypospedia. We all should know hypospedia. And there is another word is epispedia on the same line. You have hypo, it says anterior, and epispedia is the dorsal. What is hypo and epispedia? Abnormal opening on the penis. Is there any problem with the child to pee? No. Only the thing is, remember, mother may be upset, support the mother. And why? Because it's a congenital defect. And what do you tell the mother here? The circumcision will not be performed. You have second line. And the repair usually done is a little later. They don't do right away because the child can pee. So there is no problem. Only the problem a lot of time when you collect the urine specimen it will have bacteria. Why? Because the urine is washing around the penis, so it's not clean specimen. There will not be any sugar, there won't be any acetone, so there is no congenital other problem, but urine can be some question they throw. Doctor has ordered to collect the urine specimen. What would you see? So remember the word bacteria. Only bacteria. Why? Because the specimen is contaminated. No other problem. No blood, no albumin, no other thing. So hypospedia, epispedia, circumcision is not done right away. They do circumcision when the child is potty training time, they can do that time, but there's no other problem. Number 4, cryptorchidism. What is cryptorchidism? Undescended testes. And how do you treat them when the babies are born is with that undescended testes? But you must know the word cryptorchidism. That's the undescended testes. How do they treat them? And they might throw the word hormone. But what hormone do you give them? Not growth hormone. It says HCG in your package. What is HCG? Human chorionic gonadotropin hormones, HCG. So how do they treat them? They don't do surgery right away. They give them HCG hormone, and if that didn't help the baby, then later on they're going to do the surgery and underline second line orchiopexy. If they throw the word orchiopexy, the child is coming back after surgery. What do you do? Immediate surgery, we always monitor bleeding, infection, and pain. But if the question says child is going home, what would you teach the mother? Maybe answer, maybe not to ride on the bike. Or maybe is avoid restricted activities. That means don't let the child play because it's going to get hurt, pain. So everyone know the wording orchiopexy. So make sure you highlight that word. That means the name of the surgery when they repair that is undescended testes. Also, I want you to add there is teach them is one of the risk of cancer for testicular is undescended testes. Sometime they will ask, what would you teach the mother and the child? When they get older, 13 and 14, they must do testicular exam regularly. Why? Is risk for testicular cancer. So what is the, remember, we are nurses, questions are going to be the reason for cancer. So what is one of the reasons for cancer? For testicular cancer is cryptorchidism. So you will teach them the child is born with this defect and would be. All your questions are not going to be what diseases are teaching question. So remember, what would you teach them here is to avoid any toys after surgery, going on the bike, or maybe restricted activity work. And undescended testes lead to testicular cancer. And a sterility, they may not be able to produce the children. Number 5, dysplasia of the hip. The meaning is hip dislocation. And what is the sign of dislocation of the hip? Shortening of the hip, number 1, underline that. Unequal folds. If you see the baby, the buttocks are uneven. That means the folds of the buttocks are not even. Gluteal fold. And second line, abduction. Unlimited abduction. The sign is called orthogonally click, or sign is clicking of the sign when they do abduction. So when they move the baby's leg away, what do they feel here? Is lot of noise, and that is called click sound, orthogonally click. How do you treat them? They don't do surgery right away. What do they treat them? Underline the word is Pavlik harness. Highlight that, number 3. They can also use hip spica. And what do you monitor for Pavlik harness? Write down underneath, monitor for skin, because you do not remove. Child has to wear for 6 to 8 weeks and maybe continuously. So skin care is important. So Pavlik harness is used for dysplasia of the hip. Next is, you will go on, so signs we already know, is some congenital defect in the babies, in the heart, and tetralogy of Fallot. What is tetralogy of Fallot? Is called, when they give you a question, tetralogy of Fallot, the babies are blue babies. Cyanotic word. So highlight the word cyanosis. Cyanosis is blue. They're not getting enough oxygen. What would you be? There are 4 defects. What are the 4 defects are? You do have ventricular septal defect, overriding, and also pulmonary stenosis and right ventricular hypertrophy. If you can remember, we all know these babies are having hypoxia, the word, second line in your tetralogy of Fallot, hypoxia. Lack of oxygen, important. Cyanosis word is important. And what would be, the babies would have problem here, is you will put them, but what is the main problem with tetralogy of Fallot? I want you to add there, on the side, clubbing of fingers. So what is one of the first sign you will see when you have hypoxia? Clubbing of finger. So any question, tetralogy of Fallot, what would you see the babies? Clubbing of finger. And hypoxia. What would the mother usually complain? When I'm feeding the baby, baby gets very tired and baby is not drinking enough milk. Why? Because the heart is not functioning and they have hypoxia. They get easily tired. I want you to write down the word failure to thrive, and they're losing weight. Very important word is your clubbing of finger. And also, I want you to add there underneath, if you have ventricular septal defect, and they have done the surgery for ventricular septal defect. What is ventricular septal defect surgery? When they do it, what is the outcome? Outcome means the result. Why is it done in your question? So I want you to add there, when they have done surgery for ventricular septal defect, your outcome is prevent oxygenated blood, back to lungs. So what is it preventing? Oxygenated blood is not going back into the lungs. So in question, cardiac surgery. Why did the ventricular septal defect is done? Preventing oxygenated blood going back to the lungs. What is in the congenital heart defect is mixing of the blood. So that helps here. And clubbing of finger, I want you to add also any questions on digoxin. You are giving baby a digoxin. What do you monitor? Apical pulse. What is the side effect of digoxin in the babies? We have talked in the adult. And we have said earliest sign in adult is anorexia. But they are small babies. What is the side effect of digoxin is vomiting and bradycardia. So make sure you guys have that, is vomiting and pulse rate. What is the digoxin does? Lowering the pulse rate. What is the word is called? Bradycardia. So what is the side effect of digoxin toxicity? Bradycardia. And also you will remember the vomiting. How do you give the dosage in the babies? How do you count the dosage in the children? Questions are, number 1, weight of the baby. Height and weight is always there, but I want you to write down the word BSA, body surface area. Body surface area for calculation of your calories and for your drugs are important to know the word body surface area and height and weight. And how do you give babies medication here? How do we give medication to the babies here? By dropper or syringe. Never pick up your answer teaspoon. Why? Because teaspoon, if the child you have to give 2 ml or 3 ml, you cannot accurately measure. So these are type of questions you may see. You're giving medication, how do you give? We all know height and weight. The new thing in questions are body surface area. What do you do if the child vomited the medication, digoxin? Question on that. What do you do? Do not repeat. When do you give the next dose? Next day. Why? Because you don't know how much medication the child has already absorbed. So it's going to be toxicity. So everyone is okay? Because it's in cardiac, I want to finish few type of questions for you guys, and maybe in a drug. How do you calculate your drugs are? By BSA, another word, remember. Height and weight, you all know. How do you give medication? Do not pick up teaspoon word. There are droppers you have for liquid to give them using syringes, and wash them after usage so you are not contaminating. So that's important on that. Now, on next I wanted to continue. Some of pages you have on tetralogy of Fallot, the older version is ventricular septal, but I want you to add that. And before I move into the next thing is you have CHF. But before I go on CHF, I want to throw one word here, and because I did talk earlier, rheumatic fever. Rheumatic fever is very important in the children question. So, and I did talk about earlier in the medicine. So I want to highlight rheumatic fever. How does rheumatic fever comes? You guys remember? How does rheumatic fever comes here? How does rheumatic fever comes? Very good. Streptococcal or sore throat. And sore throat and streptococcal. What is rheumatic fever causes? What is rheumatic fever causing? Rheumatic fever lead to rheumatic heart disease. So I'm continuing a little bit to add and remind you, rheumatic fever question goes in the peds. And what do you do if the child has rheumatic heart disease? Is rest. Why? Because the heart is affected. So remember, bed rest for answer. We did earlier, I'm reminding you. Another thing I want you to remind in heart, you do not have in the package, is Kawasaki disease. Anybody remember Kawasaki disease? Have you done that? What is Kawasaki disease? It's a cardiac disease, so make sure, remember, if any questions come, what is Kawasaki disease is here, is altered, what is the meaning when the heart is not working? Tissue perfusion. They use the terminology correctly. When your heart is affected, you're not getting oxygenation and the blood. So what does Kawasaki reduces here is tissue perfusion. That means your body is not getting oxygenation, perfusion. And also, it's a coronary artery disease. Coronary artery disease. And what happened to the babies here is, again, the breathing problem. But what is the main thing for the babies are they have rashes and also strawberry tongue. Very, very important is a strawberry tongue. And they had rashes, and also the word is called desicremation. What is desicremation? Is peeling of the skin. Desicremation word is peeling of the skin. So desicremation and strawberry tongue, two are very important problem with the baby's heart. But I want you to remember it's a cardiac problem. So child is having Kawasaki disease, it's a cardiac problem. Maybe the answer, the wording, what is it reducing here? Tissue perfusion, because it's cardiac. Anytime you have a CHF, cardiac problem, we are not getting enough perfusion. Perfusion means circulation. Coronary artery disease, and what is the problem here? Strawberry tongue, rashes, and peeling of the skin. But they don't use the word peeling of the skin. They say desicremation. D-E-S-Q-U-M-A-T-I-O-N. Desicremation. So I wanted to add that because You never know what questions can be, even I have done. Remember, all the exams, they changes the wording all the time. They review the question. Anything I see something coming up new, I have added here. Now, next is, you guys have on your notes is CHF. On CHF is congestive heart failure. In congestive heart failure is what? What did I said in CHF? Again, I want you to write down on the side, weight gain. Right away, we said weight gain, tachycardia. We said in adults, tachypnea. Same thing. Babies is having CHF. Tachypnea, tachycardia, child is having, but first thing we remember what they are? Gaining weight. In your question, whatever question, child is admitted with CHF, child gain 1 pound in a day. What do? Notify. 1 pound in a day means child is retaining a fluid. Everyone is okay? And so workload of the heart and also objective is on the babies are treating them for their heart problem. And number 2, highlight the word weight gain. And number 1, reducing the workload. How? Reducing the fluid. Restrict the feeding. Do not overfeed the baby. Why? Because they are already retaining the fluid. In adult, I said don't give more fluid. In the babies, restrict feeding. That means don't overload feeding with the child. So what is CHF is? Too much of fluid. What do we cut down here with the babies again? Feeding. Don't give too much. Because why? Overload of the heart. Heart is failing. And they are going in what? Tachycardia, tachypnea. Whenever you retain fluid, they're not going to breathe in. The next one, we have scoliosis. Everyone has that in your pages, the scoliosis. And underline the word. We all know what is scoliosis is. Lateral curvature of the spine. But which one often you will see? Underline the word adolescent age. Then what would you be seeing here? And what is the problem if scoliosis is getting worse? And any question, curvature of the scoliosis is getting worse or is bigger curvature. What do you monitor? The child respiratory problem in breathing. Underline that. And also they have shoulder and hip, and head and hip are not aligned. And you tell them bending forward at the waist and then let their hands hang, and you're looking the curvature, asymmetry of the curvature. So underline that one. That means you're assessing. Very important is adolescent word. Very important, number A. When do you screen for scoliosis? 10 to 15 years of age. Underline that word. What do they give them before surgery to use? We call Milwaukee brace. Underline that one. And the TLSO. Sometimes they throw the word thoracic and also lumbosacral orthosis. They didn't give you the word Milwaukee. They can throw the word TLSO. So they're going to wear. How long they need to wear? All day. Only you remove for shower or 23 hours a day. That's important. What do you monitor on that is a skin breakdown. Then highlight the word log rolling. How do you turn them is log rolling. Then again, after surgery, in the last line is called Harrington rod. When they do the surgery, they put the rod and they fix it, which is called Harrington rod surgery. Log rolling position, and I want you to highlight that and write down on the side when they have done surgery. Monitor them for breathing and abdominal discomfort, pain, and urine output. Always you assess. Any question? Child is coming back after Harrington rod or any surgery, what are you assessing? If they have all that, remember, all your questions of these days are all that apply answer, not one answer. All that, pick up more answers. So what are we monitoring here is the breathing, pain, and urinary output you monitor. Next is, I will go on hydrocephalus. What is hydrocephalus is? Too much of fluid. Underline the word. What fluid is too much here? Cerebral spinal fluid. What is high here? Cerebral spinal fluid. So what is the baby's head size is not normal, and that's hydrocephalus. And what do you monitor? Write down on the top, ICP. What are we monitoring here? ICP. In second line is monitoring skull and causing ICP, and they're causing pressure. Maybe before surgery, what do you monitor the baby who is born with hydrocephalus? The size, and monitor ICP, turning them. Now what is the sign of ICP? What would you monitor sign of ICP in the babies? What would you monitor sign of ICP in the babies are?
Bulging consonants.
Yes, you do have in your package there is high-pitched cry. High-pitched cry, you can add there, early detection, depressed fontanelles when you are lower, higher would be bulging fontanelles. Highlight that. But anytime newborn baby, high-pitched cry, and also reacting to the light would be different level of consciousness. And also I want you in the one of the ICP sign R is vomiting. Now they are small babies, they may not complain. Headache, yes. Headache is also sign of ICP. But what do you monitor here? Maybe the vomiting. In your vomiting question, what do you prevent the baby from vomiting? For anybody, aspiration. What side do you turn the baby? Here again, on the side to prevent aspiration. Child is vomiting, ICP is going up. That means the baby is vomiting. Nursing intervention. See, what did I say for ICP question? What are we preventing here? Seizure. So you prevent them going into seizure, monitor their weight, we said, and status epilepticus, long seizure. What do you have? Airway. Always for seizure, we are monitoring airway. Now, what is the treatment is in number B? You have ventriculoperitoneal shunt. So what is the treatment for hydrocephalus babies are? Number one, ICP, we all know. And if the vomiting questions are there, preventing aspiration, and monitor for ICP. What would be done? Ventriculoperitoneal shunt. Child come back after shunt. What do you monitor? Again, ICP. What position do you put the baby? Keep them on the back when they come back. But if ICP goes up in your question, then what position we go? Semi-Fowler's. And what side do you turn? Unaffected side. So make sure you guys add it, unaffected. If they're saying the shunt is on the right side, you can turn them on the left side and you can keep them on the back. So what is the position here? Back and unaffected side. But if the ICP goes up, any patient, whether in a med-surg or in the peds, when ICP goes up, then what position we are doing here? Elevating them semi-Fowler's position. How do you feed the baby? Small, frequent feeding you will give them because they are vomiting, and monitor their weight. And what medication they're going to give them? Seizure medication. Everyone is okay? Hydrocephalus, what is high here? Cerebral spinal fluid. What do they have to do the treatment here for the babies? They have to put the shunt. And where is the fluid is draining? In the peritoneum. So it's called peritoneal shunt. Ventriculo. Ventricle are in the brain. And ventriculo, the name is peritoneal shunt. What do you prevent the baby? ICP, seizure, and monitor for vomiting. Next word is cerebral palsy word. It's a muscles problem. And what does the child has? Involuntary movement. Now, next line, I want you to highlight the word poor sucking problem. Any question? Child has cerebral palsy. Mother says child is having a problem in eating and swallowing. Immediately assessment for dysphagia. Maybe a poor problem. Feeding difficulties. Number B, you guys highlight the word adaptive utensils. Maybe you will need. Calories of the food is high. Second line, to make them independent. Maybe they need scooter, walker, anything assistive devices. And let the child do as much as they can. But what is the problem with the baby, with the child with cerebral palsies are muscle weakness. So highest priority in your question when you're looking, look for anything for keeping them independent. Number one, assistive devices. When they're moving around, the muscles are weak, maybe they need movement easily. Something it can help the child. PTOT and speech need to work with them and help them to give the strength to their muscle. And swallowing problem, if there is any, then you're looking for swallowing problem. Otitis media question. Otitis media is middle ear infection. What is important is here is the babies, the eustachian tubes are shorter, they're more is horizontal and wider. That's why the children get easily middle ear infection. What is another reason for middle ear infection are, I want you to add there, respiratory infection. So if they're getting repeatedly upper respiratory infection, eventually they're going into middle ear infection. Common with which babies, very important in your teaching, is bottle-fed baby in supine position. Give them the bottle and leave them on the back. They can aspirate and lead to ear infection. That will be in your teaching. How do you feed them upright and don't leave them with the bottle? Because, so what is one of the reasons for middle ear infection is repeatedly respiratory infection. Also, repeatedly respiratory infection lead to middle ear infection. Another reason are the tubes are shorter and they are wider and they are horizontal. Any word comes there. Now, what do you monitor here in the ear if they have is, I want to add where it says eustachian tube, tympanic membrane. So what are we looking? When we look in the ear for the baby's infection is called, you're checking auto exam, ear exam, and what are you checking here? Tympanic membrane. And what happened to the tympanic membrane would look more red and more infection. So question may be, what do you check? Is auto exam. And in their ear exam, otoscope, and what are you looking? Tympanic membrane. How would be the tympanic membrane? May be red, bulging, and patient will have pain, and that is the sign of middle ear infection. We all know in middle ear, the word is very important, eustachian tube and tympanic membrane. So it's a middle ear infection. And what is the child has here? It's infection, fever. Fever is high. And so you do need to monitor the fever. So number B, irritability. Child is very irritable. They have pain, and I want definitely to know they have also fever. It's infection. How do you treat them? By giving, in the next line, antibiotic for 7 to 10 days. Maybe one question is, baby comes with otitis media, what do you tell the mother? She should finish all her baby's antibiotic. Why? If you don't complete, infection is not going to be clear. So you got to complete all doses of antibiotic. Warm compress you can give them, and very important, monitor the temperature. And they might give you a question and say, how do you monitor the temperature? You don't go oral. We're having a fever, you are not giving oral. Then what would be the best is, you can take, child is very small. What do you go? Tympanic temperature. Why? Because it's a middle ear. Tympanic means you're just keeping here. Nowadays you also have, you can check it on the skin. But in your question may be tympanic word. So how do you check the temperature? Because it's more accurate then you're going more axillary and other, because you have to do the variation. So what is accurate? Oral and tympanic is the same. But a lot of time we don't pick up tympanic thinking it's a middle ear infection. But it's middle ear. We are not putting the scope very inside. We just keep it outside. So accurate temperature by is looking into tympanic temperature. Next is, I'm going to move on to the next section is number Candida's infection, mouth infection. What is Candida infections are? Is the white patches in the mouth. It's a fungal infection. Any kind of infection, what do you use? Wear the gloves. What medication do you give them? On number C is called nystatin or mycostatin. That's a fungus medication. Complete for for whatever the days the doctor has ordered, 7 to 10 days. Cleaning of the bottle is important, and wash them properly. And it's very common in the children is Candida infection. It's a fungal infection. Maybe question use gloves, maybe question what medication you will give. Now I will move on. The word is tracheoesophageal fistula. What is tracheoesophageal fistula is in the babies and I want another word is to add, sometimes they use another wording. It's called EA, right down on the top, is called esophageal atresia, A-T-R-E-S-I-A. Esophagus is not open completely. That means the babies have congenital problem in esophagus. The food is not going, after we give babies milk, it should go into the stomach. But the esophagus is not open. So they may give you the word tracheoesophageal fistula, or if they didn't give that and say esophageal atresia, same thing. That means there is a problem in esophagus. And what is the main sign and symptom of these three diseases are? So when we are saying this word, either it's closed, and where is it open towards the trachea. So when you're feeding the babies, where is the milk is going? Into the lungs. Are we clear? So what is esophageal atresia or TEF is not proper esophagus, is not open. Maybe child milk is going into the lung. So when they say the baby has fistula, EA or TEF, what do you monitor? Underline the word 3 C's. Everyone should know those 3 C's. What are the 3 C's are here is coughing, choking, and cyanosis. Only when you are feeding. Do not pick up answer when they're sleeping, because it is attached with the feeding problem. They're just checking that whether you really know the question. So what is TEF is? The milk is not going in the stomach. So what happened? The milk is going where? Into the lungs, and there is a problem in esophagus. So that's a congenital problem. What would you do when the babies have this problem is, number 2 line is monitor for respiratory problem. Pneumonia, they can aspirate, lead to pneumonia. So what do you do? Is underline the word is in your notes is pneumonia, and on the top before surgery, what do you do? NPO. And position, upright position. Keep the baby upright. These 2 are very important. Immediately when you see question or child is born with congenital abnormalities with esophageal, tracheal fistula, what happened here? The milk is going into the lungs, is leading into what? Pneumonia and breathing problem. You don't want to feed the baby. What do you do for the child? Elevate the head of the bed, NPO. Then you underline G-tube. Third thing is important for your questions are, they will put the G-tube pre-op. G-tube before surgery. but not to feed. Why do they put it in? To prevent, underline the word aspiration, and to prevent regurgitation, going back the milk. And surgery would be done. We said already NPO, G-tube. After surgery, they will use 1 week post-operatively or started the G-tube feeding. So everyone is okay, pre-op care. What do they put it in? G-tube. But do they feed with G-tube? No. When do they feed with the G-tube? After the surgery. Why? To prevent aspiration. So what they usually do, they will leave the tube open and keep it at the level of the heart. And the air which is going in the stomach, pushing whatever the baby has, swallowed to prevent aspiration. Let me repeat here. It's important that you all know the one we have here, and just make sure you review the wording and how you understand your question. Child is born with, baby is born with esophageal atresia or tracheoesophageal fistula, means the milk is not going in the stomach. And what would it lead to? Because it's going in the lungs, it can lead to pneumonia, aspiration problems. So what do? Your questions are NPO. And keep the baby head of the bed. If they didn't give anything and they said, when do you start G-tube feeding? Maybe that question is, when do you start G-tube feeding? After surgery. Everyone is okay? And 3 signs we all must know. Coughing, choking, cyanosis goes with TEF babies. And next is, I will move on tonsillitis question. Child has tonsillitis infection. Why do we do surgery with tonsillitis? When they have problem in swallowing problem, or maybe a breathing problem or infection. Tonsillectomy, they're removing, or adenoid. Is problem with them is breathing complication. Pre-op care, check for the clotting time, check because they're children, any loose teeth, because that can lead to aspiration. Now, post-op care. What is the post-op care? Is your position. What position do you put the babies with tonsillectomy or prone position? Never pick up is Fowler's position and semi-Fowler's. They're going to aspirate. Are we clear? Prone means on the stomach, or turn the head on the side. Very important, we all know the position. Which other position I told you in prone position? In med-surg, we did some surgery. Which other one I told you another position, prone position was? Amputation. Remember that? Amputation patients, I talked to you and I said, what position do you put them? Is elevate first, but after 24 hours, patient must be in prone position. Why? To prevent flexion. You have to memorize all this by your positioning, because you are going to miss your question. So when the child comes back tonsillectomy, what position do you put the child here? On the stomach or on the side? And never pick up semi-Fowler's because they're going to aspirate. And what do you monitor? Is second line is frequent swallowing. First at the end, it says frequent swallowing. What is the sign is frequent swallowing? Is the bleeding. And restlessness, sign for hemorrhage. What do you do? Child is having, if you have a question, let me repeat here, is frequent swallowing. And they're saying child returned back after surgery. And child is demanding for pain medication. Patient is asking for pain medication. And at the end, they added and also having frequent swallowing. Immediately when we read question, what are we reading? Pain. Because patient is asking pain medication, but they also added frequent swallowing. What is your priority? Answer maybe give pain medication. Answer would be notify your RN. Notify is your answer. Why? Because frequent swallowing is your priority. Means is what? Child is bleeding. Are we clear? See how you got to look your answers are? They all are good answers. But which is the best answer? Are you going to do it? So child is having a frequent swallowing means is bleeding. Pain is there, but if you have frequent swallowing, what do? The first thing, notify your RN. Why? Because his child is bleeding internally. Another question, in tonsillectomy question, child is not eating, a patient is not eating for last 3 days because complaining of severe pain. What do you do for child to improve his feeding? Give pain medication before child is going to eat. That may be your best answer. Why? Because pain is because of surgery. Child is not eating because of what pain? So what do? Relieve the pain. So give the pain medication. It's not the material. It's remember how you will read your question. How you're going to attempt to pick up the best answer. All answers would look good. And that would be hard. You can always delete a lot of answers, but you always get stuck with 2 answers. And those 2 answers are going to be very close. So everyone is okay in tonsillectomy question? Frequent swallowing. Read your question. Before you're reading, and they're saying patient had surgery and for 3 days and having severe pain, demanding pain medication, at the end they added also having frequent swallowing. And you were reading more about pain and you missed maybe the word. So please read your question. What do you do when you have frequent swallowing? Notify. When child is not eating because of pain and there's no frequent swallowing, then what are we giving here? Pain medication so they can eat better. Next is alert for hemorrhaging after 5 to 10 days, bleeding, monitor for that. And what do you avoid? In the third line, you have a straw and also vigorous coughing, brushing. Add the word coughing. What do you discourage? Now I have came across a lot of questions. What do you discourage here? After thyroidectomy and after tonsillectomy, don't let your patient cough. Remember, what do we teach? Cough and deep breathing exercise. And there may be answer, cough and deep breathing, but don't pick up cough one. Why? Because coughing will cause bleeding. Deep breathing is okay, but you discourage coughing, clearing throat, avoid a straw. And anything which can cause, ice collar is good for pain, and after the surgery, monitor for sign of bleeding, monitor sign of infection. Cast care question, I also talked about in the adult, is when we were talking about the skeletal system, same in the babies. Any child is going home with the cast care, what do you teach the mother? Monitor for circulation. So cast care, eating. Any question on eating you can go for is application of cold. Write down on eating cold, maybe a blow dryer, cold air, it's okay. Compress is okay. Eating medication is okay. But don't scratch, don't insert anything. So blow dryer here, cold is okay. Compress is fine, you can go for. Any blood on the cast, what did I say the other day, is circle. And what is the meaning circle? You monitor. If the blood is getting more outer of your circle and the bleeding is getting more, then you notify the physician. What are we preventing here? Compartment syndrome. We already talked in the adult, there's nothing much. And what kind of traction? I told you in the children's skeletal, 90 degree traction. Maybe add there, 90 degree traction is what kind of traction? Is a skeletal traction. What do you monitor for skeletal tractions? We have done that the other day. What do you monitor on skeletal tractions are? Is infection. And where is the infection? On the pin side. So monitor the drainage and infection. Child abuse question. All abuse must be reported. And what do you need to prevent them further abuse? What is the sign may be? Is mother and child have a different stories? Maybe it's not matching stories. Highlight that word. And question the family and also separately about the incident. What do you do? Mandatory reporting. Any sign of abuse, And by the time the child is in the hospital, is our responsibility at that time that we prevent what? Further child abuse. So we are preventing further abuse. Next is Mongolian spot. What is a Mongolian spot? Is a discoloration, blue and black discoloration, where? Underline the word lumbosacral area in the back. Is it normal? Yes. What do you do? Only document, because it's going to disappear and it's normal. It's not any defect that we need to notify. Sometimes they throw the wording, child is born with this problem, Mongolian spots are normal, you just document. Anything normal, lab result normal, document, you don't need to call the doctor. Jaundice question. Underline in the jaundice question, physiological jaundice, after 24 hours in the full term and 48 hours in the premature. What is the reason for jaundice? Is immature liver. And also, you will go in the third line, it peaks on the 5th day, and feed early to stimulate and also intestinal activity to keep the bilirubin. What is high here? Bilirubin. Normal 6 to 7. In your question, if they give child bilirubin is 15 or 12, what do you do as a nurse? Your answer, start feeding the baby. Breastfeeding, or maybe increase the fluid. Why? You are lowering the bilirubin level. What is pathological jaundice? Is before 24 hours. That's not good. Notify the physician. So in jaundice, you guys have already heard about that phototherapy, right? Have you heard the phototherapy? What do you monitor when you're giving phototherapy here? A skin. And what do you do for the babies? Number one, when the child is in phototherapy, cover their eyes. And also, what do they wear? Just the diaper. You remove all the clothes, turn the baby, and what do you increase here? What is the main problem with phototherapy is? Number one, skin. And number two, you got to turn. You want to expose the skin. And what do you prevent the eyes? And increase fluid. Why? To prevent dehydration. Why? Because it's a heat and they're losing fluid. And the purpose is you give more fluid, they're releasing their bilirubin. So fluid, and mother can stay and touch the baby because they have to stay. Remember, anytime you cannot take out the baby, mother can stay and touch the baby. Why? It's sensory deprivation. What is the problem here? The wording, sensory deprivation. Mother is not holding the baby and child is not getting what is sensation. So the word they use, lack of sensory deprivation, dehydration. And make sure we turn the baby all the time, frequently. Next is pyloric stenosis. What is pyloric stenosis in the baby's heart? What is pyloric stenosis is? Is vomiting. What kind of vomiting they have? Stenosis means the lower part of the stomach is smaller. There is a problem. And what happened to the babies here? What is the upper part of the stomach? Is called cardiac, and lower part of the stomach is called pyloric. And that is the lower part of the stomach is maybe narrowing. And that's why when you're feeding the baby, the milk is not going down. And what happened to the babies? They're having vomiting. So what kind of vomiting they have here? Projectile vomiting. We all know that. And what do you monitor for pyloric stenosis or dehydration? What do you monitor? The second thing. We talked about the first day, electrolytes. All are important electrolytes. Your sodium and potassium. So what do you monitor? Child who is having is pyloric stenosis and they are vomiting. Number one, electrolytes, dehydration. What else you will monitor? Aspiration. Add there, aspiration. Any question in the babies with vomiting or aspiration? What do you do when you feed them? Number one is if they're not going for surgery right away, feed them slowly. Small, frequent feeding. small frequent feeding, and all your answer after feeding, what side do you turn the babies? On the right side. That's always for better absorption and turning. And the surgery would be done. Now I want you to add there, when do you start feeding after surgery is done on pyloric stenosis? 4 to 6 hours after. You can feed them, but not the formula. What do you give them? You can give them is a sterile water. You can give dextrose, you can give, and maybe electrolytes fluid, like Pedialyte, electrolytes fluid. And dextrose may be there. But when do you really start feeding? 24 hours after the surgery. Formula you can start at the full strength. But start with what? Is sterile water, maybe electrolytes, maybe dextrose. But don't give with the, first is with the full strength formula. That may be in your question. See, questions, you know the wording, but what is the priority here? Is pyloric stenosis, dehydration, electrolytes, aspiration, and where do you turn the babies? The next is intussusception. Intussusception is obstruction. What is in intussusception is underline telescope. Like a telescope, there is obstruction. So one part of the intestine goes into the other, and it makes it as a telescope. What kind of stool the babies have? Underline current jelly-like stool. What kind of stool they have? Current jelly-like. And also, I want you to highlight the word with blood and mucus. Because sometimes question, they don't give current jelly-like. They only gave mucus and blood, and they did not have current jelly-like. So now the questions are a little bit separated, and they're using the wording away because they know everyone knows current jelly-like. But current jelly-like with mucus and blood. So mucus and blood is important. And what would be the problem with the babies are they're losing weight and dehydration. But what would be done for them are surgery. What is done here? Surgery. And what would be given before surgery may be in your question. How do you treat them before surgery? By giving enema. What kind of enema is given before surgery is important. Barium enema. So I want you to highlight the word. Before child is going for surgery, intussusception, you treat them by barium enema. And how does barium work? Sometimes your question can be on that. Is underline the word hydrostatic reduction. Hydro means the water. It absorbs the water. Hydrostatic barium takes away the water, helps them open reduction. And that will help them to open any obstruction, and child would be able to feel better, and then they can do for surgery. So everyone must know intussusception word. Intussusception is obstruction. Remember, one wording is telescope. Telescope, when you see like a intestine shape, more like a telescope because they're going one into other part of the intestine. What is the kind of stool they have? Is with mucus and blood and current jelly-like. How do you treat them before they're going for surgery is by giving barium, and they can throw all kinds of enema, not normal saline enema, barium enema, but remember for this one you only give barium enema. So it's obstruction. And afterwards, if it didn't help, they will go for surgery. Number 21 is the next one, Hirschsprung disease. That's also is obstruction. Child is having obstruction, but what is the problem here? Absence of ganglion cell. Underline that word, ganglion cell. And what would be, does it start? Lower part of the colon. And I want you to write down on the top is the rectum. Where does it start? In the rectum, in the lower part. And if you really see the picture, the lower part of the rectal area on the colon, it's like dilated. It doesn't go contraction and relaxation. So it stays dilated and they can pass the stool. I want you to add there what kind of stool they have. Ribbon-like stool. So add on the side ribbon-like stool. Now that is the difference between Hirschsprung disease and intussusception. Both are obstruction. Their stool is more ribbon-like stool. What do you monitor? The child. They may not class meconium. The newborn baby, no meconium. And also ribbon-like stool they have, abdominal distension and vomiting. What is the treatment would be done? I want you to add there. If they give enema, they don't give barium enema. They will give them, write down the word on the side, normal saline. Only normal saline. Enema. And if that didn't help them, they're going to do the surgery. What surgery would be done? I want you to write down on the side, colostomy. They do temporary colostomy. It's a newborn baby. It's called temporary colostomy. And they wait, when the baby gains about 20 pounds, they gain weight about 20 pounds, then they will do another surgery and is called the permanent colostomy. So they will be using the surgery, temporary colostomy, and permanent they will do later after the baby has gained 20 pounds. So Hirschsprung disease is what kind of stool? The difference is ribbon-like stool, both are obstruction, but here they don't have ganglion cell. That's why the rectal area remains more dilated. They're not able to relax and construct. The stool is going to be more as ribbon-like stool, and enema you will give as normal saline. I think we need to take a break now. So let's take a break. I know you guys have been